We're looking at the draft report that I shipped out to you guys at the beginning of the week. I believe that's when I sent it out, Monday. And I've tried to consolidate your 93, the consensus and recommended items into a coherent set of strategies across all 6 categories. And I'd like to go through this report sort of section by section, and if there are things that jumped out at you that you thought didn't either reflect where the group was going, or you thought that the way I had consolidated stuff didn't make sense to you, this is your chance. Because from here I will be revising, I'll be preparing the executive summary, I'll be preparing a document about the summary recommendations, which will accompany, I think, the executive summary. And then I'll get this back to you as soon as I can, probably within a week, hopefully. And then we will be hopefully trying to sign off on this document at our next and last meeting. And I know there's a couple of you who can't attend the last meeting, but we will hopefully get your feedback in advance if there's any just completely fatal flaws from your perspective on the report. Ed, is your card up for comment? Okay, thank you. Thank you. You're over with that now? Okay, all right. Thank you. All right, so if folks are okay, I'd like to just go.
I just have a general question.
A general question. Go for it. Yeah, general questions are good.
And I'm sorry if I just misheard you, but so the recommendations that are listed in here, are those going to change to reflect just these, or are those other ones going to stay in there?
The report will stay as the report, and what I would propose to do, the minimalist approach here would be to demark your priority recommendations, probably like with a star or something, as we go through the report, and then create a separate and additional document to append to the executive summary, saying these are the priority recommendations. So your executive summary and the body of the report would both reflect which of these are priority recommendations. Does that work for you?
Sure.
I think it would be a mistake to toss out all the other things that you guys had a lot of good consensus.
To me,
consensus
it's
on.
Confusing so we have all of these, and then we have another one that's focusing on these. But it's fine.
Yeah. Well, I think you guys had a lot of consensus around a whole lot of stuff, and I think that's really valuable for the decision makers and the community to know that there was so much consensus around a lot of stuff. And I think it's helpful for you guys still to, in addition to that, call out some priority items. That's what we've done. So I think both are helpful to sort of get that bow wave of support moving in the community. So are there any other process questions? We're just going to try to go section by section, and if there are some showstoppers in here for you or questions, this is a good time to let me know. Okay, so the executives, sorry, yes.
Oh, I'm sorry, I'll wait until you get into this. I just had one comment on one of the recommendations, so you haven't gotten into that.
I haven't gotten into that yet. Okay, but we're going there now. All right, hang in there. So executive summary, it'll be 1 to 2 pages. It'll cover those items right there that you see. And again, there will be an appended page or so which incorporates the priority recommendations that we've just agreed upon today. Okay? Then we get into the actual report. And this is pretty much what it will look like, subject to changes that you give me today. So the introduction, about 2 pages long, going through, and I'll just section the task force mission statement, the membership, and then there is a longer section describing the process that we went through, the 9 meetings, the types of information that we saw, the site visits, the focus group that the Everett Gospel Mission did and some of the big takeaways from that, and then the subcommittee process, and then the voting, and then at the end of the section I'll stick in a paragraph that talks about what we did today. Were there any concerns or questions in this process section? Did I miss something or misstate something? I'm very happy. Oh, no. Okay. What's up, Ed?
A comment on institutional challenges.
Which page are you on, sir?
Page 4.
Oh, I'm not quite there yet. Can you hold on?
I'm sorry. I'll hold.
So we're finishing up the section on the process and the introduction section. No comments on introduction. You have a comment on the introductory section?
Yeah, I was just curious. Did we start with 23 task force members or 24? I thought we started with 24 was the official number.
I believe it was 23.
Okay.
I'm pretty sure it was 23.
Okay. My apologies.
I'll go back and double check, but I'm pretty sure it was 23. Okay, anything else? Okay, we're going to section 2. This is the recasting the problem statement, as I've just called it the challenge. This is the problem statement that you previously reviewed and with the last edits that you
Karen?
gave me. Yes.
I did have a question on the,
I'm sorry, I missed your
that's
card.
right. I notice here we outline issues from the takeaway from the focus group. But I don't see anywhere where we describe some of the concerns that were raised when we visited the business leaders down in the city and had a discussion with the concerns that were raised there. So it seems unbalanced to me.
Well, a couple thoughts about that. We could attach the excerpts of the minutes from the meeting, but there wasn't a lot of depth. There was a lot of really good positive reaction to doing those site outreach, but there wasn't a whole lot of really specific detailed feedback on that. The reason that this particular depth of the input here around the focus group I did at the request of the co-chairs because they thought this was such a significant effort and there had been such concern at the beginning of the process that we had not included homeless individuals. I wanted to really highlight the fact that there had been an extensive effort to get input from, these are 40 individuals who are homeless individuals. So that's the reason. It is a little asymmetrical. This one subject is being noted more in the process section. You are absolutely right, and that's the reason why. I don't know.
All right.
Can you?
Yes, I can accept that.
Thank you. Thanks. Okay, so now I think we are in the challenge statement. So this again is a section, the statement that you have seen before. Are there further amended, as I thought I heard it, amended at the last session? And Ed, you have a comment or question or a suggestion?
I was, wanted to comment on the last bullet under institutional challenges on page 4, which says possible misallocation of resources, too great a focus on Band-Aid solutions, not enough on root causes of street-level social issues. Well, the opposite of a Band-Aid solution is a comprehensive solution or a strategic solution. And so I think that's really, in my mind, a fundamental problem that we are facing here is that our community, it's not just relying on Band-Aid solutions, it is not just not understanding the root causes, but it's not having a strategic vision and plan for addressing it. So I just add those words.
The lack of overall vision and focus, that was under the first bullet, or you wanted to add not enough on?
When we write possible misallocation of resources, too great a focus on Band-Aid solution, I want to add to that, not enough focus on strategic solutions or comprehensive solutions. Because I think we are severely hindered but what I consider the peanut butter funding approach, spreading the dollars all over the place without being strategic about it.
Are you okay to add that and keep also the root causes of street level social issues in
Sure.
there? Does anyone have a concern with that?
Is that a separate ballot or added to that?
It's added to that bullet.
Added.
Got it. Okay, any other suggestions for changes to the challenge statement section? Ken?
Just a comment, and it may not apply here, it may be somewhere else, but on the very first bullet of institutional challenges, lack of an overall vision and focus on bringing together our currently fragmented criminal justice. Is it really just criminal justice and human services, or is it criminal justice, EMS, hospital emergency room, and human service? I mean, it's more than just criminal justice, I think, because we did have conversations about the other first responders being EMS. And it might fit under that first bullet somehow.
Are folks okay with adding EMS and hospital systems to the first bullet?
Yes.
If anybody's not, just like Yelp or something, or raise it up. Okay, got it. Good suggestion. Anything else for the challenges section? Bob?
On the bottom of page 3, the task force identified that set of bullets. There's nothing in there that talks about the social issues related to individuals who are actually on the street and homeless, their personal issues. The language at the very bottom of the page, I think, as you captured our statements last time about being able to explain what the root cause is. I would recommend that we put that in bold, because people read through, it looks like the only thing that we saw as major social issues are all things that happen to be negative about the results of the condition that the individuals are in, and that something's really missing unless we draw attention to the fact that there is a root cause behind those.
So to boldface the last sentence there at the
Yes.
bottom of page 3? Any concerns? Okay, doing that. Thank you. I'd like to move, Tina.
I just have, and maybe it's in here and I'm just not reading it clearly. I think it might be a little bit of what you're talking about, Ed, but I want to make sure, is about when we talk about the funding, especially when it talks about the Band-Aid, is making sure that it's addressed on the restrictions that funders. We often, when you're talking about that peanut butter thing, it's like, we spread things really thin, and we sometimes fund or do what the funder tells us to do, and it's not necessarily what the need is. So,
What's your edit?
pardon?
What is your proposed edit?
I'm not really sure I have a way to add, but part of the institutional challenge is that there's, is the restriction on funders that funders institute. Pardon? That could be. But that's difficult to cite housing and services, which drives up the cost, and that's, I think, talking about the building cost possibly. Mine is, maybe we add to that bullet above it where Alan just pointed out something about, funders' restriction on the use of funds is another challenge. Maybe I'm the only one who faces those problems.
We do have it identified
Okay.
in one of the 93 items, so
Okay,
maybe
perfect.
we will get there, I think, in it's one of the express recommendations, I
did see
believe.
that. It is in that list.
Yeah, it is.
Okay, thank you.
Okay, since we only have 37 minutes left, I'm going to ask that we move forward to the recommendations piece of this report, unless folks want to stay longer. So what I tried to do here, just in part 1, was to take some of what I thought were overarching themes and stick them here so that they got a good lot of emphasis, and these really related to the systems approach, which Ed has been consistently championing, thank you, across all those different providers, and also the sort of the cross-county focus is part of it. So I tried to call out those two themes as sort of a general overarching themes, and then I went into the recommendations by category, and I tried to, because I think, remember, if we look back in terms of the recommendations and the categories came out of the homework that you guys did near the beginning of this process, where you identified things you were concerned about, and I grouped those into those six categories, and since we've been trying to focus on those as we go, I wanted to sort of keep the faith with that categorization as I move through this. So that was the approach here. Is there questions on or comments on part 1 under task force recommendations? Okay, let's go to,
Are
sorry.
you talking about category 1?
No, I'm talking about part 1. I haven't quite got to category 1. So part 2 is the description of the recommendations process there, and then we get into category 1. But before we do that, so I'm getting sort of the bottom of page 5, the top of page 6. Are there any issues or concerns with that description of what we went through here?
Can you be more explicit on category number 6 under part 2 recommendations, increase advocacy for additional funding or something like that? I mean, it just advocacy, it's pretty broad. And
We had advocacy for both funding and institutional changes and code changes and a variety of things. So the advocacy covers more than funding, I could say, for funding and other changes, but it's broader. If you look at the recommendations in that category, it's more than just money. So that's why I didn't do that. Okay, I'm going to go to category 1, and now, Chief Templeman.
Okay, I just wanted to propose just a slight addition or change in language. Page 7, top, the second bullet talks about increase.
This is strategy 1.1, the last bullet.
Yes,
Okay.
increase law enforcement presence in the commercial core areas, especially bike and foot patrols. And I would recommend just a slight modification on the next sentence that says explore use of qualified non-commissioned personnel. And then everything else
Folks
is
okay with that? Explore use of qualified, non-commissioned personnel. Good. Are there any other changes or concerns around strategy 1.1 and the supporting? Alan?
Just on page 6, the second bullet point, I would like to continue my
Yes.
opposition to that.
So can you give me one sentence that says, when I want to reflect that there was a minority opinion expressed about this recommendation based on, how would I finish that sentence for you?
Could I think about it and email you?
Yes.
Okay.
I reserve editing rights to what you send me, but I will try to capture the content.
All right, thank you.
Good, thank you. Strategy 1.2, diversion of nonviolent individuals into alternatives to detention. Are there concerns about items in strategy 1.2? Or the wording or the consolidation of items there? Strategy 1.3, taking steps to ensure individuals leaving the county jail are less likely to become homeless. We could also, like in 9, I can add a cross-reference per our earlier discussion to item 28. All right,
That would just be my recommendation overall, anytime we've combined them, to just reference that here.
good idea. Okay, thank you. Ken?
No.
Nope. Strategy 1.4, I'm on middle of page 8 here, providing skills and outreach services to the businesses and residents in the commercial core areas to help reduce crime, et cetera. This is the SEPTED program and the BOSS program. Should be 2 cool new programs here, or one new, expanding one and starting another one. Okay, I'm going to move to category 2. Providing more and enhanced services to street populations. Let's focus on the challenge section. There's a couple of things here which I think we might want to think about reconciling. Those are highlighted in your document here. One of your strongest recommendations was to increase the capacity and access to drop-in daycare centers, but the Recovery Cafe project got a 58% support, and so I think that might send something of a mixed message. If we can either ignore it and just leave the text as is, I just wanted to flag it for you.
Did everyone understand what the Recovery Cafe was when they were voting?
I think that listing out a separate, like this as the recommendation is kind of an error. I think we're recommending kind of broad things, and so expanding outreach day centers, yes, that very well may include the Recovery Cafe, but it's like saying expand Cocoon House as a recommendation. That's not a recommendation. This is
Not
just
a recommendation.
right.
So I just wanted to flag that. I have a sentence here that just notes that Recovery Cafe is scheduled to open, subject to funding. And I think it's fine to ignore it, but I did want to call to folks' attention because we didn't quite hit the mark on that.
Same point.
Okay, all right. All right, we'll move on past that one. The second one I wanted to flag is under the policy goals paragraph there on page 9. Your recommendation 34 recommends prioritizing support for programs that help people demonstrating a willingness to help themselves and go into treatment. And that could be read as something of a conflict with the Housing First model, which is basically come as you are. You do not have to tell us today that you are going into treatment. We just want to get you safe and come off the street and be in housing. So there is a potential conflict with that, and I think we can either wordsmith number 34 to say something about this doesn't diminishing our support for the Housing First strategy, which is one of the top 16. It's a big one for you guys. Or we could, I think that would be the easiest thing to do. It would be to sort of wordsmith item 34, but let me just open that up. Is that okay?
Fine with you.
Wordsmith to acknowledge that we really actually do support Housing First, even though we
Yeah.
also otherwise support this. Quid, Ed?
The Housing First model is tailored to a very specific subpopulation, those who have long-term alcohol addictions. It's not tailored, so this, I don't see it as inconsistent.
Good. Maybe that's the right way to approach the wordsmith.
I don't know as I'd limit it to alcohol, though.
Yeah, sure.
I mean, the alcohol or drug abuse issues, or other drug abuse issues.
Good, okay. Strategy 2.1. Folks have comments or suggestions around that? This is the capacity of the daycare centers. Try to consolidate all that stuff there together.
Day centers, not daycare.
Daycare, yeah. My other favorite one, I always am getting, instead of addiction, it always comes out addition. My spell checker just says, there's no such word as addiction, there's just addition. So people have math problems, and that's the issue. Okay, strategy 2.2, availability of basic service facilities. Try to sort of, and this ended up reaching out through several of the categories to get consolidated here, but I think it was a good list when it came together. Strategy 2.3, this is going countywide on special needs populations, increasing treatment capacity. If I'm going too fast, throw a rock at me. Strategy 2.4 then, expand, we're on page 11, expand outreach services to both homeless youth and adults. And again, when we have things that reached a priority recommendation, I'll be putting a star or some other item there so you can call those out. Any concerns about this grouping? Ed?
I'm sorry, I'm going back because you went past this faster than I could think about my
Sorry about
question.
that.
I'm on page 10.
Yes.
Establish a unified call center and a one-stop service center for chronically homeless individuals. Ideally, the service center would be located near the Everett Transit Center. I don't recall that discussion and how we came to that conclusion, and I don't agree with that conclusion.
I agree that we didn't have a conversation about it. It is what the ballot item says. It says, item 21, unified call center and one-stop, full-time integrated service center for chronically homeless individuals, similar to the annual Project Homeless Connect. Locate the center near the Everett Transit Center to take advantage of its extensive transportation resources. I think that that was probably a consolidation of a couple items at some point. I'm not sure that the very,
So-
Yeah,
what do you remember?
I do recall that that was a consolidation of a couple items, and there was some editing done to do the consolidating. So I think Ed's comment is fair enough that the editing may have skipped over the conversation part.
If we add the word explore a location or can,
Well, the point I wanted to make is that we have an absolutely beautiful train station. We have a wonderful hub for our transportation system. Our city needs to seriously look at transforming that neighborhood for jobs and residences, residential, for people to live near the transit station. We need a transit-oriented Everett Station area, and this item needs some deeper conversation before it goes into a document as a part of a recommendation, in my mind.
Okay, and I do recall thinking when I saw this, the way it came together on the ballot, that it wasn't, exactly as you said, Ed, it didn't really match up with the city's vision for that part of town that Dave Koenig had presented to us early on in the process. So I think it's a good point. Craig?
I would definitely support what Ed was just talking about as far as the vision for the station, and I also don't recall a discussion about location. So I think the intent is that it would be located where transit services are readily available, but that could be in multiple locations.
so explore a location.
Okay. So I'm sorry, Bob, you want to add some comments?
Yeah, part of it, the original recommendation for it was that we have transportation services running all over the city. The problem is we have only one location where it is easy to get to other parts of the community without having to change transportation, change bus lines and things such as that. And so the thought was we also have some resources in this general area with respect to Compass being nearby and the mission where there are significant numbers of individuals who need help, and today they must transit to other parts of the city to get some of the support they need. So that's the only idea. It doesn't have to be sitting right here, but I know, for example, the Homeless Veterans Committee is looking at the possibility of bringing resources into the Serve Center downstairs so that veterans have only one place to go and it's close to transportation. That was where the genesis of it.
Okay, so we can amend, it's easy, very easy to amend what we say here in the report, and if there's a strong consensus, we can tweak what that item says at item 21 on the ballot. That was a consensus item at 90%, but if folks would like to have both items reflect that it should be explored to make sure it's located near transit resources, we can certainly do that and take out what the specificity for the Everett Center, Transit
Yes.
Center. Would folks like to do that? Anybody opposed to doing that? Okay, we're doing that. And we'll do that on the ballot and in the report. Okay, anything else in strategy 2.2? Let's move down to strategy, I think we actually we were down to strategy 2.4. Or is there anything there? This is expanded outreach to youth and adults. Tom?
Yeah, just a small suggested edit on the fourth bullet.
Yes.
The PATH program already reaches out to encampments, so I thought maybe urge an expanded use of PATH resources to this effort rather than a redirection, since we're doing it.
Okay.
To a
Expanded
limited
use,
extent.
expanded focus, or expanded use of existing path resources for this effort? Okay. Expanded use. Anybody have concerns with that one? All right. Expanded, got it. Strategy 2.5, take steps to keep people from being homeless in the first place. Job training, the transport thing, I'll cross-reference. Item 9. Flexible fund. Strategy 2.6. Ensure the faith-based feeding programs operate with best practices and engage them in helping to reduce potential negative impacts. We had a couple strategies here. I've grouped them. They came from both the communication and the services categories. Okay, category 3. Is that go? Okay, so there's a long challenge section and there's a couple glitches in there I need to get to. Do you want me to speak to mine first, or do you want to go?
Sure, go for it.
Okay, a couple of little things in this challenge section. First, at the top of page 13, this is something you actually haven't seen before. You might remember way back to meeting 1, before the earth cooled and dinosaurs roamed the earth. Back at meeting 1, we had Dr. Fenn came and she talked about the point-in-time homeless counts. The data on her slides, at the top of the slides, they all said Everett. In fact, the data was countywide data when I went back to double check. So this is the actual city of Everett count. So this is, you haven't seen it that data disaggregated this way before, but this is what the PIT counts actually generated inside the city of Everett for those two populations, which are an unduplicated count. If you add veterans, it starts getting duplicated. So I just put those 2 lines here to give folks that size of that focus. So the other thing I want to just, there's a replicated sentence in the last paragraph on page 13. It says recommendations in this category. The third sentence, the point in time counts, should be taken out because it duplicates the discussion up above. And then the last thing is that there's the other holes there about the city's comp plan identifying the need for additional affordable housing units. The city's comp plan doesn't identify the need for any affordable housing units. It just has a generic need for additional units. So I would recast that to basically talk about the total number of housing units they need to meet the growing population, and identifying that right now 12,000 households cannot afford median rent in the city. So those are the things I know I need to fix on the challenge section of this. Sorry, thank you. Cassie.
So I know this isn't going to map to the data, but to me it's concerning to just talk about unaccompanied youth as 17 and under and chronically homeless adults, because we have a pretty significant population of youth that fall in that 18 to 24, which is a bit of a different population than chronically homeless adults. And so I know we don't have data, but I think it's important to reference because the studies that we've done have shown that more of a third of the homeless populations fall into the unaccompanied youth and young adults. So
Okay.
we don't
I think
have the
that's a
data,
really
but
good
some
point.
kind of a sentence around that
That
some
says-
portion of those chronically homeless adults are actually young
18 to
adults.
24,
Young adults.
As much as a third in your experience?
So,
Or-
exactly. And so but I don't want to put the data in there because
Okay.
I think that makes it unclear if we're putting
Okay.
in numbers that we can't
We
back
can't-
up. But
That's a
just
true
to say
thing.
it
Yes,
doesn't
we shouldn't do
highlight.
that. Okay.
So when we do that little, down below, when we're talking about unaccompanied youth, or maybe even starring up there, that there's a portion of those chronically homeless that would be young adults.
Okay, good point. That's a good catch. Thank you. Anything else on the challenge discussion there? Otherwise, let's move to strategy 3.1, increase the supply of permanent supported subsidized housing. This is where the Housing First model came in, which is one of your highest priorities, and then related to that, the housing levy, SROs, tax incentives for SROs, preserving affordable units, and a cross-reference to advocacy because there were some significant advocacy items that related to the housing supply. So that'll match up with the earlier discussion of priorities that we had. Strategy 3.2. Category 4, improving public understanding. We have a short challenge statement and a short single strategy. Enhance public understanding. 2 strategies, the liaisons back and forth between business and the service provider communities, which I thought was a really creative conversation. I need a period there, I see. And the hospitality program. Category 5, interagency coordination and communication, a short challenge statement, and 1 overarching strategy, which is really a lot about systems and data. Connecting with the homeless and getting that data, increasing our coordination, the centralized intake system, looking at other ways to promote collaboration. Any comments on that strategy in category 5? All right. Category 6 is the advocacy. So my one thing I did is I did not capture item 86, which is the very last recommendation. So, and that has to do with the city's budget should reflect our moral values. And I'm going to put that in the challenge section. I think it's a nice challenge section type document, and my apologies for missing that as I was putting this thing together. And I thank you to Megan for flagging that. So that's one change that'll come. Is there any other concerns or suggestions for improvement on strategy 6.1 or 6.2? Craig.
Under other advocacy items, it says support campaigns to give money to service providers. I think it should be clarified. Support campaigns to encourage the public to give money to service providers. We're not advocating it to city or any other entity.
Good point.
And
good catch.
there should be some clarification as to why we're doing that. If you could just maybe add a sentence that so the money can go to where it can be best utilized.
Got it. Good add. Anybody have concerns with that one? All right. Anything else in that last section 6? There was just a handful of sort of orphan recommendations that I couldn't smash into another strategy, so there they are at the end. But they're there, they're good. Didn't want to lose them. Okay, conclusion, we flagged that we know about David and the implementation committee that will include business leaders, nonprofit, and government leaders, and that they're going to come back to us by the end of March 2015. That there are going to be multiple partners for success here, and that one of the things that David's group should take up, this was a suggestion and a good one from Chris, that the implementation committee should identify metrics for success. We didn't identify any, but it's good to know what you're measuring yourself against, so I thought that was a good add. But I wanted to flag that since we hadn't talked about it here. Next steps, since we did vote earlier in the day that we do want to be reconvened in March, and then at least every 6 and 12 months for a couple years. So I'll make sure that that gets in here. And then thanking the staff team that has been awesome, and all of you and the mayor for the opportunity to be on the task force. Any other suggested changes to the conclusion section? Come on.
I told Chris I wasn't going to say anything because I hadn't read it before, but I just have one clarification. 3.1 and 3.2, where shelter beds are under 3.2 and subsidized permanent housing is under 3.1. But in the paragraph, category 3, the second paragraph of the title for that paragraph, it starts out with temporary shelter housing. So my opinion is this temporary shelter housing is more economical to provide than long-term housing. So 3.2 and 3.1 should be switched. So the shelter housing is at the forefront and more permanent housing is second.
I'm fine with
minor.
that. If you would like to have the short-term recommendation, just you're switching out the order in which 3.1 and
Exactly.
3.2 are presented. Does anybody have a concern about that? We're doing that. All right. Is there anybody else that needs, we have the one minority statement, which is fine. Is anybody, are folks basically copacetic? Are there things missing that you want to chat about? Otherwise, it's been relatively painless, I must say. Thank you. Making jokes. Okay, it's been a long meeting. Okay, I think, so the next, there will be, I'll send this out with a red line so you can see exactly what changes I made to this. And then this will be then that red line version will be what we take up and ask you guys to vote on at the next meeting and accept any final changes that we need at that meeting. And if we need to have it circulated further for sign off, we will do that. Otherwise, we may actually get it signed off at the next meeting. And we will also have the opportunity to talk with Mayor Stevenson, and we will talk about the communications rollout plan. So we're going to have basically a one-page document that lists, so you can put your thinking caps on between now and then, groups that you think that our valiant co-chairs should go and give a presentation to. We will develop a presentation for them summarizing your report and recommendations to get the word out about the work that you have done. So in addition to the city council and meeting with the mayor, obviously, I know we've talked about going to meet with the county council, and there may be any number of other groups in the community that you think that this task force, under our spokespeople, your co-chairs, should be reaching out to and spreading the word. So we're going to sort of put that list together as one of the to-do items at the next meeting. And that, I think, is it. Am I missing it? We are good. I'm sorry, Bob? Yes.
We consider adding another item to the agenda for the next meeting where we would discuss whether or not we want to do something ourselves besides meeting here and coming up with this list and report to the mayor. The possibility of a couple of community events that we would participate in as a group and potentially invite the community to join us that might be involved with doing something to support the feeding programs for the homeless over one of the two upcoming holiday periods, and maybe even participate, or not maybe, and participate in some type of a activity like a cleanup activity that would be beneficial to the business community and the city at large.
We can take that up, and you guys can also do it on your own, but we can certainly take that up, and if there's a groundswell that the folks would like to, yeah, we all want to do this, and this is the thing we want to do, we can certainly talk about that.
I think more than, we always can do it on our own, but I think if we do it as a group, it makes a statement to the community, and whatever it is, might very well have a bigger impact than individual.
Fair enough, we'll take that up as well. Anything else for the last meeting that you want me to know about in advance of the last meeting? Okay, well, thank you guys very much. Great work today. We're done 10 minutes early, minor miracle. Thank you very much, and I will see you in 2 weeks for the last meeting. Thank you.
Have fun tonight.